Scott Austin remembers the early days of COVID at UVA Health.
A lot of unknowns. So that was causing a lot of frustration and irritation amongst a lot of team members, self included.
The nurse manager says his team was strained, working long shifts and caring for patients while adjusting to the rapidly changing protocols that came along with an unknown virus.
I needed to become a better leader and have talk with team members in a way that I've never needed to do in the prior to COVID.
In the healthcare workforce, there's a stigma around seeking mental health care. The suicide in 2020 of Charlottesville native and emergency room physician Dr. Lorna Breen sparked a nationwide crusade to break that stigma.
We envision a world where seeking mental health treatment for healthcare workers is universally viewed as a sign of strength by the workforce.
Corey Feist co-founded the Dr. Lorna Breen Heroes Foundation, named for his sister-in-law. He says her death shined a light on an unspoken issue in the system.
The stigma around taking a break, let alone getting mental health treatment or speaking to someone about your challenges, is really reinforced from the early days of training.
Feist says his sister-in-law worried that seeking help could jeopardize her medical license and prevent her from getting future jobs. The suicide rate among physicians is double the general population, with more than 300 physician deaths a year in the U.S. Feist's nonprofit is working to prevent employers from inquiring about prior mental health issues during the hiring process, and he advocates to pass laws that fund well-being programs for healthcare providers. UVA Health is one of 3 Virginia institutions to receive funding. They've already begun implementing a system called Care First Aid.
One of the advantages of COVID is that it stripped bare the illusion that the healthcare workforce was okay.
Dr. Richard Westfall developed Care First Aid while working with the military. He says the approach teaches people how to care for colleagues.
And like all other forms of first aid, it's a lay response. It's what do we do first? It's not being a clinician, it's not being a mental health professional. This is what peers and buddies and friends and neighbors can share with each other.
Stress first aid, it's very simple, but it's not easy. Have a conversation with your team and then reach out to your support structures to give them the best help.
Austin also implements a color-coded check-in system that allows team members to easily communicate feelings during a shift.
Let me know if you need anything, okay? I don't know that I've ever had those type of conversations with employees here at the hospital.
At Chesapeake Regional Medical Center, Dr. Ray McHugh, the chief medical officer, says dealing with physician burnout has been a long-time challenge.
When you talk about mental health broadly for physicians, is because of their commitment, their responsibility to the patient, that has to come first. And oftentimes they don't have the avenues to bring that forward.
In 2020, that changed. Virginia's legislature passed a safe haven law that provided confidential resources for healthcare students and professionals seeking support. Dr. McHugh says hospital culture has to change in order to address mental health issues and burnout.
Get rid of the culture of shame and blame, and you really have to evolve into a culture of trust and transparency.
That shift could lead to a better working environment for caregivers and a safer environment for patients.
Just like you care about the well-being of your pilot before you get on an airplane, you want your flight crew or your physician or your nurse to be of sound mind and body, be at their best when they're taking care of you. And they can't be at their best under the current set of circumstances.
Thank you for watching. Continue to follow Virginia News and Stories by subscribing to our VPM YouTube channel.